Hi. So, wasn't really sure if I was going to make this video, or I'm not even sure if I'm going to post this video, but I don't know, maybe in the future it'll help somebody going through what I'm going through and what I've experienced. Um, but I decided to make this because I wanted to, first off, is kind of create a little vlog of what my experience is and what it's going to be. Um, this is I thought about doing this a week ago. I waited. Got some additional information, so this is kind of the part one and part two in my mind as I thought that they might go. But let me just kind of start at the beginning, which is back in February of this year in 2023. I went to the hospital because I thought I was having a heart attack. I was a lot of dizziness, a lot of tingling in my limbs, and a lot of dizziness standing up. So went to the hospital, and they took a bunch of blood tests, did a bunch of EKGs, and came back said, no, you're not having a heart attack, you're fine, but you are dehydrated. So I laughed and I called it my $3,000 cup of water, and came home. After they gave me an IV, just made sure that every day since then that I've been getting enough fluids and enough water. And I also live at altitude, so it's important always to drink enough water. But there's a lot of people in my age in their late 50s who, frankly, they don't follow up on a signal from their body that something is wrong. And and those are people that sometimes die in the middle of the night because they had a heart attack or something else that they just didn't go seek professional help on. So, but from that visit to the ER, though, there was one part of my blood test which was abnormal, and that was my blood platelets, and they were very low. They were down around 50. And I had noticed that I bruised a little easily. And I really didn't think much of it because my dad bruised very easily. And I remember, for the last 40 years of his life, if, he didn't have a bruise on his hands or his arms, it was more times often that he didn't have, or that he did have a bruise than he didn't have a bruise, because he just seemed to bruise himself all the time. So I just kind of thought it was, something possibly genetic. Doctors weren't real worried about that time about the low platelet number, because there was nothing else out there. Then, in spring of 2023, my wife and I took a wonderful 30th anniversary trip to Greece, and we went to on a cruise, and we actually went to Egypt, and we went to Israel, we went to Turkey, and back to Greece. Really, trip of a lifetime. But about 5 days after I got back, I got an upper respiratory infection, and it wasn't uncommon for me to get upper respiratory infections about once or twice a year. It seems like I would get one. And I immediately jumped on Zicam and, a lot of supplements and over-the-counter medications to try to push over it, and ultimately was not able to. And this was in, April of 2023 when I got sick. And I just had a heck of a time getting over it. I just kept getting worse and worse. I did go to a doctor and got a prescription for some antibiotics and for some prescription cough medicine and some other things to help me sleep. And then I got a little bit better. Got some prednisone to help me with breathing, and that seemed to help a little bit, as it always does seem to help a little bit. But I just never really was able to shake it, and I got more sick again, and went to the doctor, and they kept listening to my lungs and saying, that my lungs sounded clear, but obviously I was in distress. My oxygen saturation wasn't exactly where they wanted to be, but not of great concern. So they sent me home with a nebulizer and albuterol for nebulizer, and within about 2 days of that, and I was literally watching the clock, and was watching the clock to get to my next albuterol nebulizer treatment. I was staring intently at the clock, but waiting for those 4 hours to go by. And I just flat couldn't breathe. And so I finally, about 4 o'clock in the morning, went in, woke up my wife, and all she said was, have you had enough? Are you ready to go to the hospital? And I said, yep, let's go. So I went to the hospital. Turns out I had multifocal pneumonia. I had pneumonia in all 5 lobes of my lungs. They couldn't see it because I didn't have really a focalized point. But it wasn't until they really did the CT scans that they saw it. They never saw it on x-rays. But my oxygen saturation was down in the low 80s. They put me on IV antibiotics for several days, prednisone, breathing treatments, all of that. And I slowly got better. And now, pneumonia is not something you recover from quickly. But what was interesting when I was in the hospital is they, of course, ran a bunch of blood tests. And at that time, a lot of my blood tests were really abnormal. My white blood cell count was low. And when you're infected, you would expect it to be higher because it's fighting an infection. So they were a little confused by that. But my red blood cell count was low. My hematocrits were low. My hemoglobin was low. But then things like my blood mean corpuscle volume was high. I had a lot of things that were out of whack, and there were more than just that. The doctors there at the hospital explained it, said, well, you're very sick, you're very infected, and when that happens, it can really affect your blood. It can affect, your white blood cells, your red blood cells, and once you get better, then you should recover and you should be fine on all of those. So I did get better, and during the summer, I'd set a follow-up appointment with a pulmonologist, and that was all clear. That was all good. They did another CT scan, and my lungs were clear. So, great news. Pulmonologist said, hey, you're 58 years old, you're healthy, go live your life. Great. And I had an annual checkup with my regular primary doctor coming up in the fall. And as I looked at my tests back from when I had pneumonia, I was troubled by all these really out of whack blood tests. And so from those wacky blood tests, I sent a message. They have an app that my primary care provider, that network uses, and I sent him a message. I said, prior to this appointment, what do you think about checking those blood tests again, or checking my blood again, running them again, just to make sure everything returned to normal? And I did get a message back, and he suggested, well, that was, you were very infected, and it's not uncommon, very, very common, in fact, for your blood levels to get out of whack when you're very infected. And then I drew his attention to that February visit. And I said, well, okay, I get it when it comes to the pneumonia and infection and why that might impact my blood levels. Now explain to me those low blood platelets in February. Why did I have low blood platelets in February? And I got a message back right away that said, you're right. We'll schedule some tests, and we'll schedule some additional ones also. So he scheduled some tests, and I was able just to go in outpatient and draw some blood, and they ran the tests. And the tests came back, and they were worse. The levels were worse than where they were when I had pneumonia. My blood platelets had dropped down to 27 from 50, which is really, really low. And I was obviously bruising a lot, easily bruising in my arms, legs. I was just amazed. I was like, I don't even remember hitting my arm. I don't even remember hitting my leg, but here I am with a bruise. And I started getting kind of these petechia. It wasn't a rash, but it was kind of a funky red raised bruise in my shoulder areas that previously I would see before, but it was like if I'd gone out and shot a rifle that was a real heavy caliber rifle and shot it too long, or a shotgun, went out shooting skeet, I would sometimes get a bruise on my shoulder, and I actually went out and shot a rifle at a rifle range, and I got a really significant bruise from that. So anyway, the new blood tests came back. They were worse. I immediately messaged my primary care provider. I went to Dr. Google, of course, put in several of these low numbers, and Dr. Google Dr. Google, the stuff that came up was suggesting multiple myeloma, which is a form of bone marrow cancer, among other things. And so I immediately asked the primary care provider for a referral to a hematologist. He agreed and made a referral to a hematologist. Now, by this time, it was September. And now this healthcare group that I'm part of, they immediately sent me a request to schedule an appointment with a hematologist, and I pulled it up, and it said first appointment available is in February of 2024. Next available appointment is March 2024. And my response to that was, well, that's just not going to work for me. No, I'm not waiting until February or March to have a hematologist look at this. So I called actually to the scheduling people and said, this isn't going to work for me. I need to get in sooner than this. And they said, well, those are the only ones. And they even looked around the state. I live in Colorado. They looked in Denver and in northern Colorado. And those really were the earliest appointments that were available in the Colorado Springs area. And there were nothing available in the rest of the state. I would have driven anywhere to see a hematologist. So they said, well, you can request an e-consult. So I did that through my primary care provider, which basically means they're going to send through an electronic request for a hematologist just to review the chart, look at it. They did within a few days. And then, lo and behold, I had a hematologist appointment within about 5 days. So I went in and saw the hematologist. And the hematologist with this big care network, looked at the numbers and said, well, I mean, it does suggest some form of malignancy, does suggest something involving bone marrow, but we don't know, what that might be until we do a bone marrow biopsy. And I was like, okay, well, let's get that done. And so she said, well, we'll schedule you for a bone marrow biopsy. And they checked with the people there in the department, and the earliest they could do a bone marrow biopsy was about 3 weeks away. And that wasn't wonderful in my book, but that's what they said. And so then she said, so I want to see you in 4 weeks because you'll have the bone marrow biopsy in 3 weeks, and in 4 weeks we'll see you again. And so as I left, I made an appointment to come back in 4 weeks, and they made the appointment, but then they also said, well, this is with the nurse practitioner, not with the specialist, not with the hematologist. And again, it's a week after the bone marrow biopsy. Now I'm looking at the calendar, and at this point I'm already in mid to late September by now to get in to see a hematologist. And or actually it's early October, first week in October. And so I got to thinking, I'm like, if this is what it is, and I didn't have a real warm and fuzzy feeling. I mean, the hematologist spent a lot of time just staring at the screen and not looking at me as a patient. She did give me a check over and checked lymph nodes and things, but I just really felt like she was married to what her screen was telling her and not really listening to me as a patient. So I had a lot of information. I'd been traveled to Egypt and Turkey and all these places where there could be a lot of exposure to a lot of different things that might explain some of the things that were going on. So I got on the internet and I started looking around for who in Colorado was really good at blood cancer. And there's a place up in Denver that's called the Colorado Blood Cancer Institute, and that's the only thing they do is blood cancers. And so I reached out to them, and because I knew I had 4 weeks until I had another appointment with this hematologist, and just asked, just told him, say, I've got some screwy blood tests, and just kind of gave him a real brief on that. And they said, well, can you come in tomorrow? So, tomorrow? And this is in Denver, by the way, so it's about an hour and a half away. And I was like, tomorrow? You got it. I will be in Denver tomorrow. And so I drove to Denver and saw a hematologist there, very experienced hematologist, who was very plugged into me, listened to me, explained, what we might be looking at, and how, these particular types of cancer affect blood marrow and how they work, and said, of course, but we need you to have a bone marrow biopsy. And he said, you said you already had one scheduled. And I said, well, yeah, but it's like 2.5 weeks from now. And he looked at his assistant and said, when can we get him in? And she said, give me a moment. And she came back in and she goes, Monday. And this is like Thursday. And she goes, Monday. And he goes, can you be here for a bone marrow biopsy on Monday? You bet I can. Absolutely I can. So we made that appointment and went in for the bone marrow biopsy. And he listened to me. And one of the things he heard from me was that I wanted a team and I wanted great communication. And so after we scheduled all this and we had things set up, and he spent a good 45 minutes with me, and I don't know, in the specialist world, that was a lot more time than the first hematologist spent with me by about 3 times. And he said, well, I'll get some initial results back within 48 to 72 hours of that bone marrow biopsy. Do you want me to call you and have you come back in? Or do you want me just to call you? And I said, I'd rather not wait. So yeah, I'd really just love it if you'd call me. So went in for the bone marrow biopsy, and which, by the way, they offer 2 different ways to do a bone marrow biopsy. One of them is with anesthesia. The other one is without. And I want to be real clear how they do a bone marrow biopsy, which is basically they poke a hole with a big needle and they stick a drill in and they drill out and extract bone marrow from your hip. And a lot of pressure, some pain. They do local anesthetic if you don't choose general anesthetic or a stronger anesthetic. And ultimately I just said, let's do the anesthetic. And I'm really glad I did, because I felt nothing, and the discomfort was limited for a few days. So he did call me back within 3 days and said, good news and bad news. So the good news is we've taken a shift away from possible leukemia and into an area of lymphatic, possibly mantle cell lymphoma or mantle cell leukemia. I can't remember which it was, or another one. He mentioned some things. So, but I have to map it and gene map it. I'll have an exact diagnosis within a week. So I'm going to make an appointment now to bring you back on Friday, and I'll know what you have, and I'll have a plan of treatment for you. So the big point I want to make today is this: you have to be your own advocate. Be your own advocate. I had doctors that were looking at me, explaining away what was wrong with me, and I kept looking at these blood tests saying, we need to do a follow-up. We need to make sure everything's normal. And it was my advocacy that had me in there doing the blood test this year than waiting to get really sick later. So I'm going to stop this video here because the next appointment happened a week later, and I'll do a second video on that one. But be your own advocate. You are your own best advocate. Do not be afraid to ask questions, and do not be afraid to get a second opinion. That second opinion resulted in some things that I'll talk about in the next video, which I think are very positive for me. And it's just differences in health networks and maybe in demand of services, but we'll talk about that in the next video. But that's it for today, and this is the start of my journey. It's hopefully a very long journey, at least a long, healthy journey. And again, I don't know if I'll publish this, but if I do, glad to have you part of it.